So as we speak about erectile dysfunction, or otherwise called ED, we would like to ask one of our guest experts about what exactly is erectile dysfunction. So I would like to ask Dr. Cully Carson to explain to us what is the definition of erectile dysfunction, or ED.
There are a number of definitions of erectile dysfunction, or ED. Probably the best one, though, comes from the World Health Organization and the Consensus Conference from Paris about a year ago, when they defined it as the inability to obtain and or maintain an erection satisfactory for sexual activity.
So what does that exactly mean? Does that mean that this is something only the man or the patient can observe, or is it something that the wife or the partner can observe, or does everyone know that he has erectile dysfunction?
Not everyone appreciates it, but clearly it's a functional definition. So basically, whether you can have an erection or whether you cannot have an erection is not the important part. It's whether that erection is actually useful to you for sexual activity. And so really it's more of a functional definition than a static definition.
Now, can someone have erectile dysfunction without knowing it?
Yes, they certainly can. People who don't have partners, men who don't have partners, could certainly have erectile dysfunction. Erectile dysfunction can be permanent. It can be episodic. It can happen as a result of something that's happening in their lives that can be changing over time.
Can someone be in denial of erectile dysfunction?
Very often they're in denial of erectile dysfunction. I think you have some data on that very issue.
Yes, we did actually do a study recently that was published in one of the scientific journals, and the study showed that men, sometimes up to half of men with erectile dysfunction, do not really recognize it, do not acknowledge it. And this is especially important in men who have risk factors for erectile dysfunction, such as high blood pressure, obesity, smoking, or other risk factors. So how common is this condition, Dr. Carson? Is erectile dysfunction very common among men?
There's some very good information that we have about that. Approximately 50% of men over the age of 40 have some degree of erectile dysfunction.
You said 50%. That means one out of two.
Half of the men in the United States over the age of 50 have some degree of erectile dysfunction. It may be partial, maybe complete, or it may be moderate.
That's remarkable.
It's absolutely remarkable. And studies have looked at international prevalences, or how common erectile dysfunction is around the world, and those same numbers occur over and over again, whether it's Europe or Asia or Africa. The numbers are very, very similar.
Now, if erectile dysfunction is so common, then I'm sure those patients are not only in the urologist office, but they would be also in other specialties. So, Dr. Musa, in your practice of cardiology, do you see men with erectile dysfunction? How common is it?
Erectile dysfunction is very common in patients with coronary heart disease. There's many studies, and some give the estimate about 70% of patients with coronary heart disease have erectile dysfunction. Typically, also that this have started before they were diagnosed with coronary heart disease. Because again, this is an early manifestation, should be a red flag if someone have erectile dysfunction that they may have actual cardiovascular disease.
So let me make sure we understand this point. You say that men with vascular disease, heart disease, had erectile dysfunction before they had the heart disease and the vascular disease, and this was a red flag. What does that mean?
It means that patients with erectile dysfunction, especially when the cause is vascular, they would manifest their problem before they manifest their heart problem, because the arteries to the penis are smaller arteries. So this could be considered, erectile dysfunction can be considered a symptom of cardiovascular disease. This is what some people are advocating, that to ask patients about the symptoms, because if people have erectile dysfunction, they should be screened.
Well, it's not only a symptom. It appears to me from your description and your study that it's an early symptom. It's a preceding symptom to...
It's a non-cardiac symptom of cardiovascular disease. Now, the study we've done, again, it goes back 5 or 6 years. We looked at about 800 men with possible coronary heart disease, not kind of firm diagnosis. And a lot of these patients did not have sexual activity the month prior for unclear reason, partially maybe because they have erectile dysfunction. However, men who did have sexual activity, about 70 to 80% of them had erectile dysfunction with the standard definition.
So this is like 3 out of 4 men with heart disease or vascular disease have erectile dysfunction.
Correct.
That is indeed a very amazing piece of information.
Yeah, and this is actually, again, a missed opportunity because very few, I would say, cardiologists or even general practitioners bring this issue up and ask patients about erectile dysfunction. I think this is a call that this should be considered a part and parcel of the symptomatology of coronary artery disease, and patients should be asked about it when they're interviewed by the general practitioner or the cardiologist.
Now, this obviously goes to the overall big question about men's health and the importance that men visit a doctor. Every man should visit a doctor once a year and have a complete review of health, including sexual health. So erectile dysfunction not only has a negative impact on the man or the patient with erectile dysfunction, it also has a negative impact on the partner and frequently the female partner of the man with erectile dysfunction. So to discuss that, we go to our guest expert off-site, Dr. Marian Dunn, Associate Professor of Psychiatry at the State University of New York, downstate in Brooklyn, New York. Dr. Dunn, welcome on the Dr. Ridwan Show.
I'm delighted to be here.
May I ask you, what is the impact of erectile dysfunction on the partner and frequently the female partner of a man with ED?
I think women can go through various stages. At first, a very typical response is to feel responsible. What am I doing wrong? Am I not sexy? What's going on here? The next sort of reaction is to feel rejected. Gee, maybe it's that I've gained too much weight, that I'm over the hill, something is going on. So they're often confused. And then they may feel frustrated because they don't know what to do. They're afraid to make any advances on their partner because they know that this problem makes him feel humiliated and embarrassed, so they don't want to pressure him. So they may stop approaching and sort of sidling up and being seductive for fear of being rejected. Now, there are women who are relieved when their partner develops erectile dysfunction. They never enjoyed sex and they're glad it's over. But very often, when a woman has encouraged her partner to go for help and he's refused to go, she becomes resigned and resentful and is facing, for her, a life without sex.
Thank you very much, Dr. Dunn, for this important information. So, in this segment of our episode on erectile dysfunction, we really learned a lot of things. We learned that erectile dysfunction is defined as the inability to obtain and or maintain an erection satisfactory for sexual activity. We learned that erectile dysfunction is very common in men in general and very common also in men who have cardiovascular disease. We learned that erectile dysfunction has a negative impact on the patient and on his partner. However, we will also see in the next segments of our episode on erectile dysfunction that successful treatment of erectile dysfunction has a very positive impact on the man with ED and on his partner. So stay tuned and stay with us on the Dr. Ridwan Show in the next segments of this episode on erectile dysfunction.